it's a good reminder to take care of our hearts and, of course, consider our risk factors. So joining me here today, Dr. Gurpreet Sodhi. He's a cardiologist with Sutter Health, and he's going to tell us about all of the important signs and the symptoms that you need to look out for. So, Dr. Sodhi, thank you so much for being here with us today.
My pleasure.
Of course, so it's American Heart Month, February. It's not just about love and Valentine's Day, but a good reminder to take care of your physical heart.
Yes.
When your patients come in, what do you do just to determine if they could potentially be at risk?
Yeah, a lot of it is just talking about their symptoms, getting their family history, making sure, get their social history to see if they're drinking or smoking. Those are the basic questions that we start with.
Okay, so it's not that intimidating.
No.
Yeah, you could come in, answer some questions, and you were telling me that nowadays people with heart health problems, it could start early. It doesn't happen later on in life. It could be someone that's young, 20s, 30s.
Absolutely, and we're seeing heart disease start at early as 20s, 30s, and unfortunately, I think it's because of the epidemic with our obesity epidemic, high cholesterol, diabetes, where we're not screening as early as possible.
I see. So screening is very important here. You definitely want to emphasize that today. Also, symptoms to look out for. Let's say you haven't made it to the doctor yet, but if you do feel certain symptoms, what is going to raise that red flag that you need to talk to someone?
Yeah, I think the classic symptoms are chest pain, shortness of breath, fluttering, palpitations. Those are the classic symptoms that most people would think about. But what you have to realize, there are some atypical or non-specific symptoms that we have to worry about. Fatigue is actually something I often see. Postmenopausal women are often ones that specific population that we have to worry about where they have non-specific symptoms. And you can't get it explained. And so I would encourage patients to just continue asking questions, get educated, continue screening.
Yes. So tell me a little bit about a screening. If someone wants to go in and undergo a screening, what does that look like?
Yeah, so a primary care provider, a physician assistant to a physician, a cardiologist, it could be anybody. Really, it's just starting with a blood pressure check at home as well as in the office, and then also asking for a cholesterol check as well as a diabetes check. Those are the three most common reversible risk factors that we see in this country and actually globally, to be frankly, that could lead to a risk of heart disease.
That's so interesting. You said it's reversible.
Yes, absolutely. So diabetes is a treatable disease, high blood pressure is a treatable disease, as well as cholesterol. These are things that we've known for many, many years. In addition, lifestyle changes is what we usually discuss about: smoking, cutting smoking out, moderation in drinking as well, and also exercise are the most important things that we need to educate our patients.
So that's great news. It sounds like there are solutions, there's steps that you can take if you are suffering with any heart risk symptoms. And also the screening sounds so simple. You could just do a blood pressure test, no needles, no poking.
Absolutely. It's just a conversation, back and forth questioning. What you can do at home is just get a blood pressure cuff, start checking it every day, recording it, and bring it to your provider.
Incredible. So if people want more information, where can they go?
Yeah, so I represent Sutter Health. We're a comprehensive cardiac care center. We're certified by JACO. We have other institutions in the local area. Just start by making an appointment. That's what you really need to do. Pick up the phone, take some proactive measures, and especially this is American Heart Month. This is a reminder that we need to be proactive for our health.
A great time to do so. Thank you so much for stopping by,
My
Dr.
pleasure.
Sodhi, and sharing these great reminders.
Thank you for the invitation.